Part 2. Common cases found in home caregiving and how to deal with them. 10 ways to prevent falls for seniors in the home. Do you know that nearly 50% of the falls experienced by seniors take place in the home itself? Well, there isn't any need to get worried, as I have some good news for you. All you need to do is bring about a couple of improvements and modifications in the senior's home. Also, following the suggestions included here will help to prevent your seniors for innumerable common hazards that may lead to disabling or, in rare cases, fatal falls. These suggestions are sure to help seniors lead a safe life. With aging, the risk for falling increases because their senses dim and nervous systems tend to deteriorate. Elderly people often suffer from weakened vision, and the balance mechanism in their ears becomes less accurate. The sedentary lifestyle of theirs may lead to muscle loss, thereby leading to falls. In seniors, even a minor fall may at times lead to fractured bones. How to make our home a safe place to live for seniors. Bathroom. A risk-prone place. That's true. Falls more commonly take place in bathrooms. Hence, it would be advisable on your part to set up bath benches in your bathroom so that seniors are at a lower risk to slip. Also, arrange for toilet risers, toilet safety frames, grab bars, and tub and shower treads. Well, I guess you get me. I intend to say that you need to make your bathroom slip-resistant. How? Well, that's a good question, I must say. To begin with, for adding steady support in case of slippery situations, you need to install non-slip strips on the shower floor or tub. In addition to this, you need to place non-skid mats on the floors of your bathroom. You can also look for grab bars that have been approved by the ADA. Falls among seniors can also be a result of dim light or poor vision, particularly in areas such as basements and stairways. So how can you avoid that? Well, your first step lies in installing brighter light bulbs throughout your house. It would be better if you opt for bulbs with greater longevity, as they'll never burn out at a time you need them the most. Opt for bright lights for your bedrooms, bathrooms, stairwells, and hallways. While new fluorescent bulbs have a greater longevity as compared to conventional incandescents, yet despite this fact, some may not like the light they deliver. Go for motion sensor switches, which turn on lights automatically while entering an area. You can also go for light switches which glow, hence you can look for them easily during the dark. Make sure you install night lights close to the floor for lowering the chances of falling or tripping while you need to pay a visit to the bathroom during the nighttime. Another way through which you can help seniors from tripping is by clearing off debris from hallways, stairs, and walkways. Try removing the scatter rugs. If you fail to do so, then it would be ideal on your part to secure the rugs to the floor using heavy-duty and double-sided tape. You don't have to wander hither and thither in search of these. Simply walk up to any hardware store and order for one. You can play safe with the stairways if you paint a white strip. Ensure the measurement is somewhere around 2 inches, on top of each step's edge. Try using a gritty paint as it helps your seniors in staying more sure-footed while they move up as well as down. This isn't all. Seniors are at a greater risk to fall from the carpeted stairs as well. But you can avoid this problem if you use white-colored non-skid tape. Keep an eye on the electrical cords and make sure they don't obstruct any footpaths. Don't overcrowd the cabinets, bookcases, and shelves, and make sure they aren't too high. This approach will prevent the seniors from using a stepladder or stool while taking off things from the cabinets, bookcases, and shelves. Try placing a chair or bench close to the entrances, as this will provide you a secure and handy place for setting down bags or sitting down while slipping your shoes on and off as well. Get their vision and hearing checked on a routine basis. In other words, start the checkups even before noticing problems. Consult with a doctor about the drug therapy for ensuring that after taking it, you won't feel dizzy. Elderly people should avoid standing up quickly, as this may make you feel dizzy and probably fall. Prior to standing, try wiggling your feet and toes and swing your legs if needed. Try exercising on a routine basis, as this helps in strengthening your muscles as well as improving your agility. However, prior to this, make sure you consult your doctor. Before standing up, try moving enough so that your blood pressure and heart rate increases. At last but not the least, elderly people should limit their consumption of alcohol. With aging, the risk for falling goes on increasing. It is true that most of the falls lead to minor injuries, but at the same time, nearly 10 to 50% lead to fractures as well as other serious injuries. Falls may take place anywhere, but a senior may more commonly experience it in the home. To be more specific, falls are likely to take place while getting out or climbing the bathtub. In addition to elderly people, people suffering from weakness in legs or feet, problems with balance and walking, arthritis, particularly in the knee, problems with vision or hearing, dementia, low blood pressure, dehydration, also run at a greater risk of developing falls. In a nutshell, the more risk factor a person is prone to, the more are their chances of falls. Prevention of falls for seniors continued. Falls are one of the common occurrences in a person's life as they grow older. There are many reasons that can cause a fall for seniors. It is indeed a big problem, and falls can sometimes prove to be life-threatening. There are many people who are affected badly by the falls, resulting into permanent injuries. Injuries that can result out of falls are broken bones, head injuries, and even accidents that harm the interior body parts. Head injuries can be more damaging than any other falls and can cause problems like memory loss or blood clots. Falls for the seniors can be easily prevented if we use some of the prevention tips that help to cut down the accidents. Let's look at some of these valuable tips. A. Enroll the seniors for an exercise program. Now, body fitness is a big thing when it comes to preventing falls. Seniors can enroll for fitness programs that would make them physically fit, thus reducing the chances of a fall. One can on the yoga or Tai Chi classes, as they are neither very taxing on the body nor provide very tough regimens to follow. Fat and unfit bodies are more prone to falls, and the only way to avoid these is regular exercise. Exercise can also help to reduce fat and provide the necessary fitness to legs and hands. It is better to practice the yoga moves or exercises that help to improve the strength of the leg muscles. You can seek the help of an expert or doctor in order to guide you to choose the right exercise program. B. Safe home to live at. Falls at home is a common thing, and most of the falls occur at our homes. You must remove the objects that can cause you or the seniors at home to trip. Things like books, shoes, and other objects can cause real problems for the seniors, as there is a fear of tripping over them. Use tapes to stop the rugs from slipping over. Try to put the daily use items in the closet and keep them at a height that you or the seniors can reach easily. Install the grab bars beside the toilet or bathtub. The mats that one uses should not be slippery, and try to wear the shoes that are not slippery and provide a good holding on the ground. C. Get an eye check. You need to ensure that the seniors have a proper vision, and the only way to do so is to get it checked by the doctor. The doctor can provide glasses or lenses that would improve the vision if there are any such problems. It often happens that seniors keep on wearing the same glasses for long without getting their eyes checked. Now this is a sure way of getting falls. Proper and regular eye checkup is necessary for the aging eyes. D. Get your medicines checked. You need to get the medicines of seniors checked by the doctor, as they may be taking medicines that make them drowsy. You need to be a little more careful about the medicines to avoid the falls for seniors. The care of a person in the early stages of Alzheimer's disease. Alzheimer's is a common form of dementia in which a person faces problems with their memory or thought process. Memory or thought-related problems can affect anyone irrespective of their age or sex, and when this starts hampering daily life activities, then this can mean real trouble. The changes can even affect the personality or the mood of the patient. The number of dementia-related cases is somewhere near 4 million, and out of this, 2/3 suffers from the problem of Alzheimer's disease. It is often seen that we forget about an incident that might have occurred only a few moments back, but this is not the sole symptom of being affected with something as serious as Alzheimer's. The former case may be a simple problem of a temporary memory failure where the brain fails to recollect information. The symptoms of Alzheimer's are divided into 2 broad categories: early stage and late stage. In the early stage, the patient faces the frequent loss in memory, mostly the ones that are related to the recent events and conversations. We even get to see problems like repeating questions, problems with speaking a language, writing, and even using a few objects. Depression and changes in the personality can also occur, and there are also problems with spatial orientation while walking or driving. These problems keep on increasing with time and take an acute shape, and that is what forms the symptoms for the later stage, where people face almost complete memory loss. For instance, they forget why they have to come to a particular place, or why they are walking, etc. There are no straight treatments available for the problem of Alzheimer's, and only proper care can make the lives of the patients easier. It is really a challenging task to take care of a patient with Alzheimer's disease, and this can at times prove to be tougher than one can think. A caregiver would face new problems every day, and they have to adapt themselves to the fast-changing demands of the patient. The behavior pattern of the patient changes, and the caregiver needs to make a lot of changes in their caretaking procedure to get acquainted to the new sets of demands. Here we are going to look at the things that can make your job of taking care of a person in the early stages of Alzheimer's a little easier. After your family member or a loved one is diagnosed with Alzheimer's, you need to start making changes in your lifestyle and the place you reside so as to make things easier for the person. Changes are necessary in order to create an environment where the patient would be physically safe and at the same time would feel comfortable. You need to restructure the social lives of the person, as it won't remain normal with every passing day. The environment of the home needs to change, so as one needs to understand that things won't remain the same anymore. The ways of communication also needs to change, and development of new ways of communication should be emphasized upon. For instance, one needs to have prior scheduling for visits to the patient in order to avoid surprise. But this doesn't mean that one needs to snap all social contacts with the Alzheimer's patient. One also needs to make a proper structure of the daily activities that are to be performed by the daily living. One also needs to help out the patient make social contact on a regular basis. You need to set up a safe environment in the home so that the patient does not meet with any accidents at home. The condition of the patient deteriorates as the days pass, and one should understand that the patient becomes emotionally fragile. The emotional support needs to come from the side of the caregiver, and this can create a sense of well-being in the patient. Even emotional support helps to allay the fears and anxiety that build up in the mind of the people who suffer from Alzheimer's. It is better not to use logic in order to alleviate the fear in these patients, as they lose their capacity of rational thinking. The risks of accidents and injuries would increase with time, so it is better to always be prepared for them. It is better to rearrange the house to avoid any types of untowardly incidences. You need to be sensitive towards the patient, as there are going to be problems that can make your job tougher. If you want to inform the patient about the diagnosis, then it is better to do that in a roundabout manner. Do not directly tell the patient that they suffer from the problem of Alzheimer's, and instead tell them that it has something to do with their memory problem or anything better that comes to your mind. You should be patient enough while dealing with the queries of the patient, and if you are performing a task that the patient is supposed to perform, then try to explain to them why you are doing it. You need to have a positive attitude towards seeing improvement in the patient and should not get bogged down by the initial setbacks. Patients who are in the early stage of Alzheimer's would get worse as they move to the late stages, so one should be ready to expect worse things. If you are taking care of an Alzheimer's patient, then you need to communicate with the patient in a way that they can rely on and have faith in you. Be supportive to the patient, not only when they show up the negative traits, but also appreciate if he does anything new or good. You need to understand that these patients are going to have behavioral problems, but you also need to be ready to cope up with the same. Taking care of Alzheimer's patients is certainly not an easy task, and one needs to take good care of oneself in order to provide the best support to the patients. The care of a person in the late stages of Alzheimer's disease. Alzheimer's and its late stages require a completely different approach in the care of the patient. The care does not get restricted to providing emotional support and taking care of the simple needs, but it now shifts to a more complex environment. You need to take round-the-clock care of the patient, and there is hardly any room for leaving the patient alone. In the later stages of the disease, it progresses in a disorderly fashion, and this is why there is a need to take care of the patient in a proper way. This time is very crucial for the caregivers or the people who take care of their Alzheimer's inflicted loved ones. It is very challenging to take care of the patients who are in the late stages of Alzheimer's disease. It is often seen that a caregiver gets so attached with performing their daily duties, but this is the time when they need to accept the bitter daily reality that death is a reality that is not very far away from their loved ones. The sense of bereavement can at times make the caregiver mentally weak, but they have to gather themselves in order to perform their duties properly till the last breath of their loved one. One should understand that despite the best care and treatment, their loved ones are slowly nearing death. The late stage of Alzheimer attacks the patient so badly that they are not even in a position to communicate properly, and they are completely dependent on the caregiver. They are bedridden and look forward to their caregivers even for their daily requirements. This is the time when they lose all their memory and do not remember even their loved ones with whom they might have spent happy days even a few years back. They become more and more dependent on their caregivers, as they are not even in a position to verbally let their needs or requirements be known. You must know the fact that at the late stage, the patient of Alzheimer's is not at all in a position to sit, talk, walk, or eat, and they even cannot make any sense of the world around them. This is the time when the caregivers go through a testing time. They have to take care of daily activities of the patient, like bathing, feeding, toileting, and dressing. You have to be in a position to take complete care of the patients, and this is the time when the caregivers also need to be mentally as well as physically fit. Memory loss in the Alzheimer's disease doesn't mean that the patient loses their feelings. They experience normal feelings like fear, sadness, peace, loneliness, love, etc. Now, you are the only person who can provide solace to the patient, and you are also the only one who can allay all their fears and discomfort. It is best to not leave the patient alone while they are awake, as they would not be able to communicate their feelings, but their bodily gestures may provide you with some hints. In the late stage, one can even look at other options for patient care, as it is not always possible to keep the patient at home. Looking at the physical safety needs of the patient, or the need for an advanced treatment, one has to find a hospital or care center where the patient can be under 24-hour monitoring. The decision to keep a last-stage patient at home means that the caregiver has to have a lot of mental strength and complete family support, without which there is no way a person can stand the jitters. If you are keeping your loved one at home, then you need to make a world of changes in the way you have been living, and also the place where your loved one lives. The patient's needs for the changes are to be first jotted down, so that you do everything to make the adjustment of the patient pretty easy. It has been often seen that the people who are in the early stage do not face problems with adjustments, but patients in the late stage can feel completely lost with minor changes. Well, this is attributed to the fact that the late-stage patients do not have the ability to remember even the smallest changes around them. Here are a few things that would help you to understand whether you are in any position to take care of an Alzheimer's patient. A. See if you are in a position to take a 24-hour care of the patient or not. This is very important, as you need to understand that Alzheimer's patients in their last stages require complete support even for their smallest daily activities. B. Find out whether your room has the provision for a hospital bed, commode, or wheelchair. This is because the patient needs to move the least amount possible. C. Is there a proper transportation support so the patient can be moved whenever an emergency crops up? D. You also need to judge whether you possess the necessary stamina to lift or carry your loved one or not. The last stage of Alzheimer's completely cripples a person both mentally as well as physically, so you have to mentally prepare yourself to be close to a person who cannot even communicate his daily needs in a proper way. There is a big difference in reading about the difficulties and actually experiencing the same from close quarters. The caregiver has to be very attentive to catch even the smallest gestures of the patient to understand their requirements. One has to be so habituated with the patient that there is not even a single movement of the patient that misses one's eyes. One needs to learn some soothing techniques like massage, fragrance, music, and touch so as to provide a holistic comfort system to the system. The people who perform the job of a caretaker should themselves have a support system, as they are the ones who have to witness the agonizing days of the patient before they finally expire. If you are a caregiver, then you must learn to get proper grip over your emotions and become mentally strong. Autism and how to care for an autistic patient. We have very often come across the term autism in our daily lives. There are many of us who have heard the term, however, we are still not sure about what it actually implies. In general, autism is a pervasive developmental disorder that impairs a child's normal development of language, communication, and social interaction skills. Many are still unaware of the actual causes of the disorder and its treatment options. The subject of autism has been one of constant research, and there have been many scientific breakthroughs in its diagnosis and treatment process. Autism is a brain disorder that deals with an abnormal self-absorption with oneself. It is marked with communication disorders and a short attention span. Autism involves restricted and repetitive behavior in patients, and the signs of autism begin when a child is 3 years. There are 2 other autism-related disorders, which in medical terms are called Asperger syndrome and pervasive developmental disorder, not otherwise specified, PDD-NOS. Both of these disorders fall under the category of autism spectrum disorders, or ASD. Asperger syndrome. The patient displays significant difficulties in social interaction, coupled with a series of restricted and repetitive behavioral patterns. Those afflicted with autism are physically clumsy, and they frequently use a typical form of language. Pervasive developmental disorder not otherwise specified, PDD-NOS. PDD-NOS is a milder autism disorder. In this disorder, the patient does not suffer from all the symptoms of autism. Autism and both the autism spectrum disease are complicated neurodevelopment disorders, and its causes are still not definitely proven. A lot of research is still on, and medically, doctors are of the opinion that autism is a genetic disorder. There are some rare cases where autism is caused by some birth defect-causing agents. There are some that are of the opinion that certain after effects of vaccines may be the cause of autism. However, such hypotheses have no scientific evidence and have not been convincingly proven. One can easily identify the early symptoms of autism in children. Autistic children display comprehension and language development impairments. They respond poorly to name, and they have deficient nonverbal communication. For example, they lack appropriate emotional gestures, ignore people, prefer to be alone, lack of pointing and problems with following a point, lack of social interaction skills with others, etc. The indicators of autistic behavior in very young children are no babble, pointing, or gestures by the 12th month, no single word by the 18th month, no 2-word spontaneous phrase by the 24th month, and any loss of language or social skill at any age. Autistic children either ignore or have a very friendly attitude with adults. They tend to prefer loneliness, and they love being in their own imaginary world. They prefer solitary activities, and they have a social imagination that they generally do not share with others. They have social impairments, and they are oversensitive to moods and touch. They tend to play repetitive games with toys, for example, lining up of objects and the turning on and off of light switches, despite repeated scolding. Autism can also be present in adults, and normally the Asperger syndrome disorder sometimes transits into adulthood too. This type of autism is called classic autism, and there are many people who are unaware of these traits in adults. Autistic adults function independently and on most occasions also obtain college degrees. Psychiatrists and pediatricians in the past, and sometimes even today, are reluctant to pronounce adults as autistic out of compassion for their parents. These adults have poor living skills and are either reclusive or eccentric. They have a level of social awkwardness, and they tend to prefer being on their own. They may be unable to care for themselves and fail to comprehend the social behaviors of others. They are generally obsessed with a particular subject, and they tend to bring up the topic of any discussion back to their interests. They tend to become angry if they cannot do what they want, or if they are stuck in a schedule that disinterests them. They are generally not empathetic and do not understand the emotions of others except their own. People with autism also have problems with keeping track of time when they are engaged in activities that they like doing the most. They tend to stack and organize things on shelves, and they love to do solitary activities. Autistic adults have a lack of emotional control, and though their emotional outbursts may not be like a child, it can be very irritating to any normal person or bystander. One cannot physically identify a person with autistic traits. However, when communicating with a patient, one may be able to ascertain the levels of autism, as its levels differ from individual to individual. Some physical characteristics of autism may include: the face has low muscle tone. The eyes may be large with pupil dilation. The skin is pale. The tendency of banging one's head. The tendency of slapping one's ears. The motor skills of the patient are impaired. Children with autistic tendencies have problems painting, coloring, solving jigsaw puzzles, and doing other normal classroom activities like normal children. They are very slow in development than other normal children. These characteristics may differ from one child to another, and in most cases, therapy can make a difference to treatment in these patients. The following are some important real facts about autism that are beneficial to understand the disorder more clearly. Autism occurs in 1 of every 150 births. After cerebral palsy and mental retardation, it is the 3rd most common developmental disability in the world. It occurs more often than the diseases of childhood cancer, cystic fibrosis, and multiple sclerosis. The disorder begins before the age of 3 years. Experimental regimens of diet, coupled with mineral and vitamin supplements, are successful as therapy, and treatments are done through medical interventions and behavioral therapy. In many cases, insurance companies do not cover or recognize various treatments for autism. Significant improvements have been observed with the recent treatment and medical therapies. Both autistic children and adults live a normal lifespan. Autism is a spectrum disorder, and the care of autistic patients differ from individual to individual. There are no laboratory tests to confirm autism, and one can identify its symptoms through a detailed developmental case history of the child and clinical examination. A psychological evaluation should be carried out by a professional to confirm whether a person is autistic or not. The psychologist generally conducts a series of autism screening tests to determine whether a patient is autistic or not. There is no hard and fast rule that autistic patients need to be treated with medicines. There are many effective strategies that can help one with dealing with these patients. One should keep a notebook or a detailed journal about the patient. One should always track the developmental history of the patient. One may be asked to keep a set of questionnaires, which will ask about the behavior and development of the patient. Writing the daily developments of the patient will help one successfully keep track of the patient. Moreover, one can also observe what can work and what cannot work with the patient. This notebook and journal comes in handy when the patient may be difficult to handle at times. It helps to identify the patterns for difficult times and the triggers for the problems that may be faced by the patient. One should have a positive attitude when dealing with an autistic patient. There may be some days when the patient responds positively to therapy, and on some days there may be reverse reactions. One should not be motivated and discouraged with the results. One should be patient and have a very understanding attitude towards the autistic child or person. In the process, one can also find out what they think works for the patient and what does not. It helps in the long run, as the person becomes aware of what he needs to avoid. The autistic patient may have fixations, like making repeated noises, staring at turning wheels, etc. There may be some obsessions with objects, TV programs, animals, etc. Control and tolerance of this behavior within controlled parameters can be a powerful tool that can help in the patient's educational, emotional, and social instruction. One can relate to the interests of the patient and thus gain the confidence of the patient. This leads to acceptance of new things, especially in children who suffer from autistic disorders. Using this time with the patient can help one relate and hence connect with the patient on a higher level. When caring for an autistic child or patient, one can find support in the company of other autistic caretakers and hence get essential help. There are many trusted individuals who can provide child care and advice on how to deal with patients having the same disorder. One can check with one state health department to check. There are special health departments that can take care of patients with similar healthcare needs. One can also resort to visual stimuli. Most autistic children are visually oriented, and very often they love to communicate with the use of sign language and pointing out to pictures in a special book that may be put together to help them communicate. Even an autistic child who speaks may be able to communicate better with the help of visual stimulus. If one wants to teach the child something, the use of a picture book comes in handy, and the child responds well to the technique. Some autistic children can repeat verbal instructions word to word, however, they are not able to convert their thoughts into actions. Pictures very often can help them do that, and hence it is a successful mechanism for teaching autistic children. Autistic individuals often have poor auditory processing skills. As a result of this, they often do not understand what people are saying to them. They tend to hear the words, but they do not understand what the words actually mean. Very often, the person's lack of understanding can lead to confusion and utter frustration to others. Very often, this may also escalate into behavioral problems. Picture visual aids can also help them to a considerable extent. Sometimes an autistic child may demonstrate behavior problems at school, but not at home, or vice versa. For example, the parent may have already developed a strategy to tackle and stop such behavior at home, but the teacher is unaware of this strategy and the child continues to be troublesome. In such cases, the parent and the teacher should interact on a regular basis to solve this problem in the child. If the child's behavior is bad at school but not at home, there may be many possible reasons for this behavior, such as a lack of consistency. There can be physical causes, and it has been observed that cleaning solvents and fluorescent classroom lighting can trigger negative responses in autistic children. The janitors very often use powerful chemicals to clean classrooms, and the smell of these chemicals remains in the class even on the next day. Chemical residues often induce negative reactions in very sensitive people. Children place their hands on chairs and tables and end up inhaling the smell. They may even wind up in the child's mouth, thus making him sensitive. The chemicals affect brain functioning and, in turn, behavior. This has been observed that after parents and teachers wipe the students' desks with water or natural cleaning solution prior to class each morning, they have reported rather remarkable improvements in the behavior of the autistic children. One can check if there are any early intervention programs that are available in the locality. The school district authorities can be contacted for evaluation of the child, and thus the child can be enrolled for any special preschool program on the advice of a specialist. One can also make a special request to the local school authorities and check whether they have any special programs for autistic children. The child needs to qualify for the special program, and one should make sure that the school has set up an individual education plan for the child. This document is a very serious document that ensures the child gets the special service and education needs. The free and appropriate education that is given to the child is called FAPE. One can refer to some good parenting theory books that will help in the treatment of autistic children. There are many guides that are available, and one may take resource to them for help. Autistic patients, both young and old, need constant care and attention. Autistic adults can be classified in two categories, and they are high-functioning autistics and low-functioning autistics. FLA. There are numerous healthcare professionals and organizations that can offer valuable advice on how to deal with these patients. The high-functioning autistic adults are very successful, and they live relatively normal lives. They can work, care, and support themselves, and live independently with a family of their own. To lead a normal life, the HFA adult must have a proper education while growing up, and if he has been effectively taught, he can understand social behavior and responses. By the time the child reaches adulthood, then he can adjust and contribute to society. Some high-functioning autistics may still face or have to struggle with social interaction. There are organizations with healthcare providers that can help them, and they can be consulted for support and guidance. The low-functioning autistics, FLA, need constant care and attention like autistic children. They too should be taken to healthcare specialists for guidance and proper progress evaluation. There are a number of approaches that are used in the treatment and therapy of autistic patients. Some of the most popular ones are the structured and language therapy, social skills therapy, and occupational therapy. Healthcare professionals resort to these natural therapy tools to treat patients, and in the event of extreme cases, they resort to medications. The healthcare professionals keep a daily track of neuropsychological reports to monitor progress and developments. Autism is not a disorder to be dreaded, and with professional guidance and personal evaluation, a patient can lead a normal life. With family love and support, an autistic patient can be successfully treated. Autism is not a disease, it is a disorder that requires compassion, constant care, and a supportive and understanding attitude towards the patient. There are many organizations that extend support and generate awareness on autism. Families of autistic patients can take recourse to these organizations and get invaluable advice and support for dealing with autistic patients and their well-being. Both parents and professionals can benefit from these programs and hence make autistic patients live a more better and fulfilled life. Review questions for the bonus reading section. 1. The ideal caregiver is someone who knows his or her responsibilities, maintain punctuality, very open to suggestions, and takes pride in his or her job. A. True. B. False. C. Neither. 2. The responsibilities of the caregiver include all of the following except A. Routine personal care, hygiene assistance. B. Prescribing medications. C. Rides to doctor's appointments and errands. 3. Blank is defined as skillfulness by virtue of possessing special knowledge. A. Limitations. B. Identification. C. Professionalism. 4. A caregiver should always wear tight-fitting jeans or pants to work. A. True. B. False. C. Neither. 5. Should you maintain personal hygiene as a caregiver? A. Sometimes. B. Always. C. Never. 6. Blank means the quality or habit of adhering to an appointed time. A. Responsibility. B. Professional. C. Punctuality. 7. If you find your patient slump all of a sudden while eating at the dining table, what should you do? A. Call 911, start CPR, call your agency. B. Run. C. Just ignore your patient because you are just there to make money. 8. An ideal caregiver does not adjust to the needs of the patient. A. True. B. False. C. Neither. 9. Some problems that could occur when caregivers put themselves last include all of the following except A. Meeting their own needs. B. They become ill and hate their job. C. They do not deliver appropriate care to their patient. 10. The United States made 3 12-hour shifts full-time to burn out caregivers. A. True. B. False. C. Neither. 11. If you want to be an ideal caregiver, then you need to stay in good health. A. True. B. False. C. Neither. 12. As a caregiver, you should keep your own self-updates about the disability or disease of the patient. A. True. B. False. C. Neither. 13. Bad communication is believed to be the most viable quality of a caregiver. A. True. B. False. C. Neither. 14. The 3 areas involved in keeping yourself safe as a caregiver involve all of the following except A. The 5 senses. B. Information, sexual behaviors. C. Interrogating the patient. 15. Some of the signs of frustration are A. Feeling happy. B. Singing all the time. C. Headache, knot in throat, desire to strike out. 16. Calming down is necessary when there are any tensed situations involving the patient. A. True. B. False. C. Neither. 17. Any uncontrollable situations should be dealt with right away. A. True. B. False. C. Neither. 18. Some common ways of decreasing your stress involves all of the following except A. Meeting physical needs. B. Praise for yourself. C. Going on a romantic date with your patient. 19. Bad communication with the patient or to someone related with the patient is not important. A. True. B. False. C. Neither. 20. Blank communication is a form of expressing that is ineffective and maladaptive. A. Passive communication. B. Aggressive communication. C. Good communication. 21. The most effective and healthiest form of communication is the blank style. A. Aggressive. B. Passive. C. Assertive. 22. Assertive style of communication is the style people use the most. A. True. B. False. C. Neither. 23. There are blank communication techniques which can help you get the message across towards the patient. A. 3. B. 5. C. 7. 24. The first and foremost thing is to put ourselves in their shoes. A. True. B. False. C. Neither. 25. Listening carefully and respectfully to the values and beliefs of the patient and respecting them in your day-to-day activity is what is referred to as A. Cultural activity. B. Assessment sensitivity. C. Cultural sensitivity. 26. Blank is referred to as the way of life of the people. A. Norms. B. Culture. C. Beliefs. 27. Advantages of cultural sensitivity involves all of the following except A. Avoidance of conflicts. B. A stronger connection with the client and the family members. C. Respecting your own feelings, desires, and needs. 28. Communication is not the best way to negotiate with any differences arising out of cultural sensitivity. A. True. B. False. C. Neither. 29. Escorting a patient should not be confused with accompanying a patient to a destination. A. True. B. False. C. Neither. 30. A caregiver who is escorting and transporting a patient should not be aware of the medical history and the clinical condition of the patient. A. True. B. False. C. Neither. 31. Some of the probable reasons of a fire breakout are smoking, cooking, and a couple of other fire hazards. A. True. B. False. C. Neither. 32. The battery of the alarms needs to be charged at least blank in a year. A. Twice. B. Checked. C. Once. 33. Politeness and simplicity is the only manners needed in conducting proper phone etiquette. A. True. B. False. C. Neither. 34. With aging, the risk for falling increases because their senses dim and nervous system tends to deteriorate. A. True. B. False. C. Neither. 35. It is true that most of the falls lead to minor injuries, but at the same time, nearly blank to blank % lead to fractures as well as other serious injuries. A. 10-60. B. 10-50. C. 10-70. 36. Injuries that can result out of falls are broken bones, head injuries, and even accidents that harm the interior body parts. A. True. B. False. C. Neither. 37. Blank is a common form of dementia in which a person faces problems with their memory or thought process. A. Lupus. B. COPD. C. Alzheimer's. 38. The symptoms of Alzheimer's are divided in two categories: blank stage and blank stage. A. Late, noon. B. Early, late. C. Early, evening. 39. The emotional support needs to come from the side of the caregiver, and this can create a sense of well-being in the patient. A. True. B. False. C. Neither. 40. The early stage of Alzheimer's attacks the patient so badly that they are not even in a position to communicate properly, and they are completely dependent on the caregiver. A. True. B. False. C. Neither. 41. Memory loss in the Alzheimer's disease doesn't mean that the patient loses their feelings. A. True. B. False. C. Neither. 42. The last stage of Alzheimer's completely cripples a person, both mentally as well as physically. A. True. B. False. C. Neither. 43. Blank is a brain disorder that deals with abnormal self-absorption with oneself. A. Alzheimer's. B. Mad cow. C. Autism. 44. Autistic children tend to play repetitive games with toys, for example, lining up of objects, and the turning on and off of light switches. despite repeated scolding. A. True. B. False. C. Neither. 45. Some physical characteristics of autism may include: A. They are neat and well-behaved. B. They communicate with adults only. C. The skin is pale. Face has low muscle tone. 46. There are laboratory tests to confirm autism. A. True. B. False. C. Neither. 47. The autistic patient may have fixations like making repeated noises, staring at turning wheels, etc. A. True. B. False. C. Neither. 48. Autistic individuals often have good auditory processing skills. A. True. B. False. C. Neither. 49. The high-functioning autistic adults are very successful, and they live relatively normal lives. A. True. B. False. C. Neither. 50. The blank adult autistics need constant care and attention like autistic children. A. Low-functioning. B. High-functioning. C. Normal functioning.